So you spent 9 months straightening your teeth and your dentist finally tells you you finished your last aligner. Congratulations. However, now it's time to think about retention. Retention or retainers are what we use to stop the teeth moving back or relapsing to where they were previously. And this relapsing or movement back is most likely to happen within the first few months of you finishing your orthodontic treatment. Why? Because as you move your teeth, the bone that you're moving your teeth into has to become spongy to allow your teeth to move into that space. So once you stop the orthodontic treatment, that spongy bone is still existing and the teeth can just move back to where they were previously. So what kind of retainers are out there? Firstly, there's a fixed retainer. A fixed retainer is a small wire that goes behind canine tooth, your third tooth along, to the other canine tooth, so it holds the first 6 teeth in place. The beauty of a fixed retainer is because that wire is cemented on the back of those front 6 teeth, you know you don't have to worry about it and those teeth will not move. The wire is not visible from the front, and although your tongue will play with it for the first few days, you'll find you'll quickly get used to it. The big issue that patients find with this though is it's a little bit difficult to clean. You can't floss between your teeth anymore because you've got a wire that stops things getting down there, and plaque buildup is a little bit heavier on the back there. So you have to use interdental brushes to clean and just be a little bit more meticulous when you're brushing. The second type of retainer that we commonly use are called removable retainers or Essex retainers. And these are very similar to your Invisalign trays that you've been wearing anyway. They're clear plastic and they just sit on top of your teeth and stop them moving. These are great as they will cover all of your teeth, not just the front 6. So that means there's no risk of any of them moving. They're also very easy to get used to because you've been wearing them anyway. However, they do mean that you have to actually wear them. If you don't wear them as your dentist tells you, your teeth will move back. Invisalign also make their own removable retainers called Vivera retainers, and even if you haven't had Invisalign, you are able to have these. Just ask your dentist about them. The material is slightly more robust and they should last a little bit longer than your standard removable retainers. What do I recommend? I recommend the golden combination. Golden combination is the fixed retainer on the back of the front 6 teeth, and you wear that all the time. You don't have to think about it, and then just every night wear the removable retainer over the top. If you do this, we know that your teeth are not going to move. Normally, I'd recommend wearing removable retainers for 3 months full time while that spongy bone hardens slightly, and then go on to nighttime wear, and that's pretty much forever. When I say forever, I don't mean every night for the rest of your life. At first, for the next 3 months, yes, every single night. Then after that, you can wear them every other night, then every 3rd night, and just keep wearing them until they feel a little bit tight when you put them in. Because if you feel a little bit tight, it means your teeth have started to move slightly, and that's the perfect amount of time. Fixed retainers generally last quite well, but as we all know, nothing lasts forever, so you just got to be a little bit careful with it. Things that might happen is it might break, it might debond or come off one tooth, and it might need re-cementing back on from time to time. If you need a new one, it's quite simple to do. We just remove the old wire, remove the cement, and we replace it with a new one. Just try and get in with your dentist as soon as possible to reduce the risk of your teeth moving back. Again, removable retainers won't last forever. They will pick up staining. If you grind your teeth, they'll wear down. They'll look a bit worse for wear. So every few years, they'll also need replacing. Fixed retainers need cleaning as you clean your teeth. So brush your teeth twice a day as you would normally. Brush the backs of your teeth and around the wire. And then you need to get the interdental brushes and just slot them in between each one. When you remove your retainers in the morning, just clean them when you clean your teeth, but not with toothpaste as it can take the shine off them. So just some warm water, scrub it with a toothbrush inside and just keep them nice and clean. There's also something on the market called Retainer Bright, which is little tablets that dissolve in water, and you can put your removable retainers in those, and it just gets rid of all the plaque and the tartar and all the bacteria that can sometimes sit on them. Makes it a little bit more hygienic.